everyone. My name is Maisie Hak. I'm from Redwood Caregiver Research Center. I'm one of the family consultants at our agency. Today, I will be talking about our services, but also the caregiver stress while you're caring for a loved one as well. Okay, so we mainly focus on the family caregivers themselves. So as for those of you who are caring for a loved one, you know that this caring for someone does affect your health, affects the whole family system. Okay, so it was estimated that 44 million adults are providing care to loved ones with disability, some type of disability, or to an older adult. Okay, and so with this unpaid assistance, it's averaged to be about $306 billion annually. And that's double the amount of home care health and nursing home health combined together. So that's a lot of money annually that caregivers are providing for their loved ones, and they are not being compensated for. So many caregivers continue providing intense care to others while having their own health issues themselves, or because of the stress from the caregiver, they could develop health issues. So such as high blood pressure, cardiovascular disease, weakened immune system, cancer, diabetes, arthritis, body pains, headaches, digestive problems, weight changes, cognitive or memory issues, and so much more. And oftentimes, family caregivers are less likely to engage in preventive health behaviors. And I forgot to mention that I say caregivers, but I know some caregivers, they don't identify themselves as the term caregiver. But for this presentation, I'm going to use family caregivers. Okay. And so they're less likely to engage in preventive health behaviors just because there's lack of time for self-care. And so with that lack of time for self-care, sometimes doctor appointments are rescheduled, or they are missed, or they don't have time to do things that are good for their health, or they run out of energy to exercise or to prepare a good meal for themselves. Sometimes caregivers, they forget to take their own medications, or their coffee is still left in the microwave. And so their health is affected in a negative way. Okay. So they're affected physically, but also mentally. Okay, so caregivers shows higher levels of depression and mental health problems than their non-caregiving counterparts. And so just because of the added on stress from the caregiving and juggling a lot of responsibilities, the household chores, the errands, the bills, yard work, right? Transportation, doctor's appointments. That's a lot for one person. So caregivers suffering from depression are more likely to have coexisting anxiety disorders. Okay, so substance abuse or dependence and chronic illnesses as well. So caregivers report higher levels of stress and describe feelings of grief over the loss of their loved one's health, grief over their own health, right? Grief over how life is now, or how life could have been, right? Future goals and dreams change. Frustration and anger, because anger around why is this happening to us, right? Anger around not feeling like there's control in situations, or frustration and anger around just the demands in caregiving and responsibilities in caregiving. So feeling drained, or guilt for thinking a certain way, or guilt for saying the wrong thing, or guilt for not thinking that you're not doing enough, right, for the care receiver. So also feelings of helpless as a result of providing care. So caregivers' perceived burden level usually increases as their loved one's functional status declines. And when that happens, there's more of a, caregivers are at a higher risk for harmful behaviors to themselves or to others. And so most caregivers provide care with little or no support at all. And so that means, again, no time for themselves, right? And I think we talk a lot about self-care, and I say the more, self-care helps you decrease the stress, but it won't help take away the amount of stress that you have. It will help you build that emotional reserve to handle the stress that does come up. So you're not hitting the burnout level. Right? So if your burnout level's here and this is your stress, it doesn't take a lot to hit that burnout level, right? So with some self-care or focusing on yourself, giving yourself permission to do things that you want to do will help decrease that burnout. So you have, with the same amount of stress, you have a little bit of wiggle room. And so studies have shown that increasing positive health outcomes for caregivers by creating assessment and care plans, primary care and interventions, just to help identify current areas of needs or concerns in the caregiving, education and support, respite care, so family members could get away with a peace of mind. And also financial support can help with the caregiver's health as well. By doing so, caregivers' health is a public issue, a public health issue. And so to address this, we need to go to a policy, as high as legislation. Also with healthcare professionals, and then also yourself as caregivers. And so with caregiver resource centers, we are one of 11 caregiver resource centers. So I put RCRC standing for Redwood Caregiver Resource Center, and then CRC stands for Caregiver Resource Centers. So throughout California, there's 11 caregiver resource centers. So wherever there's a caregiver in California, there is a caregiver resource center for each county. And we were established in 1984 as a nonprofit agency providing support for family caregivers. And so we offer free support from families and caregivers across all income categories. There's no income eligibility for our services at all. And so we've partnership with Sonoma County Area Agency on Aging. And then also we're a program under North Coast Opportunities in Ukiah. So how we are funded is by through the California Department of Healthcare Services, and then through the Older Americans Act, Title III-E. Okay, and then also contributions from our generous supporters and so on. So to be eligible for our services, you have to be either 60 and over or caring for someone with an adult onset neurocognitive impairment or any other disabling condition that occurred after the age of 18. And so such as a Parkinsonism or traumatic brain injuries or strokes, some type of dementia. Okay, and the list kind of goes on. And you must be caring for someone that's over 60 years old and needing assistance with the activities of daily living. And in order to do that, in order to become a client, we ask that you contact our agency. And how this works is we usually do an intake. So kind of gathering your basic information and demographics, just so we know who we are talking with. And from there, if depending on our clients' needs or their wants, if they are just wanting to be on our mailing list, that is fine. If you're on our mailing list, you'll get notifications of upcoming workshops or support groups. But we also offer a longer meeting, which entails a comprehensive assessment, which a series of questions to help identify current areas of needs and concerns in the caregiving. So that way we know how to provide support through our agency or give information and resources as well. And from the comprehensive assessment, we come up with interventions or a summary of interventions on the current needs and concerns. Okay, so the other services that we provide is specialized information. So just information about the disease or about certain illnesses or about neurocognitive disorders, about any caregiving issues that a loved one might have, like behavior management or legal planning, about driving or anything that affects the caregiving, we have information about. Also, we have a ton of information about community resources. If you're needing information about anything about how to build a ramp or which agency will help build a ramp or which agency have medical supplies, we can offer contact information as well. Or if you're thinking about placement, we have information about placement. For our services, we also provide family consultations and care navigation. So we do one-on-one consultations. Because of the pandemic, we are only doing over the phone, one-on-one over the phone or through Zoom as well. So for these consultations, we can provide ongoing support, emotional support, or just consultations around any caregiving issues that loved ones might have. And so that way we can provide, again, just either that listening ear or just information and resources. So we also offer short-term counseling just around any caregiving issues that family members might have. And we do contract with a licensed therapist that we can connect you with if you're needing short-term counseling. Okay, and usually the short-term counseling through us is about 6 sessions. We also offer ongoing support groups that meets monthly as well. And this is only for family caregivers. And it's not caregivers of specific diseases or illnesses. These are caregivers who are just caring for anyone over the age of 18 or who is an elder. So if you like more of that information or that flyer, I could either send it to Mark or Tess, sorry, and they could email you our flyer, or you could contact us and we could give you that information as well. We also offer monthly video trainings, and it's a little bit different than the support group that we have. It's more of watching a video and discussing a certain topic. So each month is a different topic, and they are facilitated by in partnership with Kaiser, but you do not have to be a Kaiser member to join these video groups. And again, they are meeting through Zoom, same as our support groups as well. We also offer education workshops for caregivers, community members, and professionals, and how to help caregivers manage the day-to-day care or the future planning as well. We also, with all of our sister agency, there's monthly workshops, online workshops that are about an hour long, and it's free, and it's on various different topics as well. And so again, if you contact us, we can give you that information. The other service that we do offer is a limited respite grant. The respite grant, again, is to help pay for someone either in home or out of the home. So either an adult day program or in a short-term facility or in home, right? Having somebody come into your home. So you could get caregivers can get a break from the caregiving with a peace of mind that their loved one is being cared for as well. And so on top of the respite care, we also partner with Parkinson's Association of Northern California. They have their own respite grant that they like us to distribute for them. And so all of you are eligible for this $450 respite grant if you're interested. All you have to do is just contact the number below, the 916-357-6641, and let them know that you are interested in their respite grant. And from there, they will talk with you on how you could get approved for the grant, and then they will have us distribute the grant for us. And so with that, this is our contact information. 707-542-0282 is our main office number. We also have a toll-free number, which is the 800 number. But if you don't have time to contact us, we do have an online portal, a new online portal that you could go on and you could get a lot of different information, a lot of different fact sheets, watch a lot of videos and connect with us that way as well. And I put the website in blue.